In this section, we're going to be looking at some of the health benefits that come from physical activity. This opening image gives us a great introduction to some of the benefits of participating in a regular physical activity program. Now, it's important to understand that when public health guidelines are developed, there's a focus to integrate scientific information across all the health benefits and identify a critical range of physical activity that appears to have an effect across the benefits. Research has revealed that once a person starts to experience health benefits from physical activity, any additional amounts of physical activity will provide additional benefits. Now, some benefits seem to begin with as little as 60 minutes a week. However, research has revealed that 150 minutes of moderate intensity aerobic exercise consistently will reduce the risk of many chronic diseases. And these types of exercises can include brisk walking, cycling, swimming, jogging, and other similar type activities. There is a relationship between physical activity and health. But before we get to that relationship, we need to define exercise. Exercise is a form of physical activity that is planned, structured, repetitive, and performed with the goal of improving health or fitness. So, as the textbook points out, all exercise is physical activity, but not all physical activity is exercise. Let's look at some of the major research findings. We've learned that some physical activity is better than none, but certainly regular physical activity is desirable. Most health benefits occur with at least 150 minutes a week of moderate intensity physical activity. Both aerobic and muscle strengthening physical activity are beneficial. Health benefits occur in every studied age, racial, and ethnic group, so the positive effects of exercise are widespread. And finally, the benefits of physical activity far outweigh the possibility of experiencing any adverse outcomes. The first question that many people ask is, what is aerobic activity? This can result in a very chemically based and difficult to understand response. But we can break it down into some simple observations. Let's listen to this short video that gives us the indicators to look for when we're trying to exercise aerobically.
Hi, I'm Janie, and welcome to Bangor Metro Moment with WABI and the CW. Just about everyone can say they get some type of physical activity each day. That's great. It doesn't matter whether you're swimming, walking, vacuuming, or just cutting the grass. It's all good. However, there are two things you need to ask yourself. First, are you getting enough aerobic activity for it to be helpful? Second, is it doing you more harm than good? Next time you exercise, think of it like this. If you can't carry on a conversation, then you need to slow it down a bit. And if you're not warm and perspiring, then you need to pick up the pace. Sweat is a good indicator that you're on the right track. Feel your heart rate elevate and keep it there for 30 minutes. But your heart should never be pounding out of your chest. And forget about no pain, no gain. If it hurts, don't do it. Exercise should feel good. So forget about the hair and the makeup. This is going to make you feel beautiful from the inside out. For more tips on how to have fun and feel good, visit bangormetro.com.
So that gives us some things that we can perceive as we exercise to know that we're in that aerobic zone. As we talk about this kind of activity, we also refer to it as endurance or cardio activity. And it's when the body's large muscles move in a rhythmic manner for a sustained period of time. Aerobic activity has three components: intensity, or how hard the person is working; frequency, or how often a person does the activity; and repetitions or duration. How many times do you do it, or for how long are you engaged in it? So in summary, studies have clearly shown that regular physical activity does provide many health benefits. Be sure to read through your textbook to learn about the health benefits associated with regular physical activity. Now, we've been talking a lot about these benefits, but let's look at what happens when we increase our physical activity. When we aim to increase our physical activity, we must be concerned with overload, progression, and specificity. Overload occurs when the physical stress placed on the body is greater in amount or intensity than what you've done in the past or what's usual. In other words, to see improvements, we have to increase the stress on the body's structures and functions, within reason, of course. Progression is very closely tied to overload. Once a person reaches a certain fitness level, he or she progresses to higher levels of physical fitness by continued overload and adaptation. And specificity means that the benefits of physical activity are specific to the body systems that are doing the work. For example, aerobic physical activity largely benefits the body's cardiovascular system. One of the best ways to describe specificity is to look at a concept called the SAID principle. Let's look at this short video that describes this principle.
Hi guys, Coach Nick here. Really excited to shoot another video here and talk to you about a principle that is really important because this is really one of the most important principles of everything we do here at Better Body Fitness, and I'm always excited when I get to take and break down some of the science behind why we do what we do. Makes me feel a little bit like Bill Nye the Science Guy. So, this is called the SAID principle. So if you look from the acronym here, specific adaptations to impose demand. What does that mean? It's really cool because I think it is an amazing thing the way our bodies are made and how cool they are, that they will specifically adapt to what is being asked of them. I heard this in two different analogies when I was going through school, and my favorite one is the fact that if you've ever looked, like, let's use Usain Bolt for an example, if you watch the Olympics, right, one of the fastest men alive, got muscles pretty much everywhere, he's very lean and toned and ripped. And on the flip side of that, even though he's one of the fastest guys alive, if he were to go run the Boston Marathon, he would not win. And if you look at the guy who wins the Boston Marathon, he doesn't look like Usain Bolt. Usually he's longer, leaner, and very almost stringy looking. My wife always tells me that scrawny looking is the term she always uses. So what is happening there is the SAID principle. Their bodies are specifically adapting to what they are asking their body to adapt to. The marathon runner, he is training for endurance and long distance running. His body is adapting to that. The sprinter is asking his body to go faster. Again, another example to make that really clear. Just because I become a better basketball player does not mean I will also become a better baseball player. The body will specifically adapt to what I'm asking it to get better at over and over and over again. So, breaking this down here at BBF, specific adaptations to impose demands means that we know that your body is specifically going to adapt a specific way to the imposed demands or what we're asking the body to do. Using that running example, if we ask you to keep running sprints, potentially, as if you really are training and doing that and you're tracking your progress, you will get faster. If we ask you to keep running 30 miles, eventually running 30 miles won't be as hard because your body will adapt to that endurance style training. So here at BBF, right, we have these overdrive days, we have these afterburn days, we have some of these days right on overdrive where I'll tell you we're trying to push your heart rate as high as we can. Why? Because we are imposing a demand on your body that's going to drain it of oxygen and going to put all this metabolic burn on it. It's going to make this body burn tons and tons of calories. So the adaptation of the body is, hey, I got to burn more calories because I got to replenish this. On these afterburn days, right, where we say you're going to have noodly arms, we're going to really put the muscle burn in. What are we doing? We are imposing a demand on the body saying we want a lean, muscular look on this, that toned look on it. So the demand is different, and so the body will adapt differently.
So that gives us a little introduction to this SAID principle and how it, when we talk about specificity, that we will see specific adaptations based on what we're doing. So if you're doing aerobic work, you're going to see the adaptations occur in the cardiovascular system. It's going to improve your endurance. If you're doing muscular strengthening, you're going to see those adaptations occur at the muscular level. So we have to be very conscious about what we're trying to, what our goal is, and then what measures we use to attain that goal. The benefits of physical activity on cardiorespiratory health are some of the most extensively documented of all the health benefits. And it's important to remember that heart disease and stroke are two of the leading causes of death in the United States. People who do moderate or vigorous intensity aerobic physical activity have a significantly lower risk of cardiovascular disease than do inactive people. This regular physical activity will also have an impact on our metabolic health. It strongly, if we engage in regular physical activity, we will strongly reduce the risk of developing type 2 diabetes, as well as a concept called metabolic syndrome. The metabolic syndrome is defined as a condition in which people have some combination of high blood pressure, a large waistline, and adverse blood lipid profile. And there we're talking about our cholesterol numbers and triglycerides, and impaired glucose tolerance. Now, metabolic syndrome might be a new term for you. So we want to take the time to look at a short video to help us understand what makes up this syndrome.
About 6 months ago, Graham West says he got fed up with his lifestyle.
The fact that my clothes didn't fit, I was tired, I wasn't exercising, I know I was eating things that I shouldn't have, and I was really looking for a program that seemed to make sense.
West came to the Weight Center at Mass General Hospital in Boston to lose weight, and in the process, he was diagnosed with a potentially life-threatening condition called metabolic syndrome.
Metabolic syndrome is just the tip of the iceberg, as those who have it are 5 times more likely to develop diabetes and 2 times more likely to develop a stroke or have a heart attack.
Metabolic syndrome is a group of risk factors that include increased waist circumference or belly fat, high triglycerides, elevated blood pressure, high blood sugar, and a low HDL or good cholesterol. If a patient has 3 of these 5 risk factors, a diagnosis of metabolic syndrome is made.
Metabolic syndrome is serious and often hides beneath the surface. By that I mean patients don't know they have it, and medical providers don't often screen for it. And let me have you stand up and we'll check your waist circumference.
Dr. Butch says a larger waistline or central obesity is the most common risk factor for metabolic syndrome, and it's often the missing piece of information needed to diagnose the condition.
Listen, we measure blood pressure very well, we check cholesterol levels, but we often don't measure one's waist.
And he says it should be measured because metabolic syndrome is on the rise in the U.S. due to the rise in obesity. About 35% of Americans, almost half of those older than 60, have the condition, and the rate is especially high in women and Hispanics. But once diagnosed, the risk for metabolic syndrome can be greatly reduced or even reversed by losing just 5 to 10% of body weight.
We focus on lifestyle changes, whether it's diet, exercise, sometimes sleep changes, or even reducing stress.
It's working for Graham West. 6 months into the program, he's lost almost 20 pounds. But more importantly, he's lowered his blood pressure, improved his cholesterol, trimmed 4 inches off his waist, and no longer has the diagnosis of metabolic syndrome.
I'm going to be 70 years old, and I think it's now or never, so I'm going to really work at this.
In Boston, I'm Linda Champa for CNN.
Overweight and obesity occur when one takes in more calories than are burned, and therefore it's easy to understand why engaging in physical activity will in fact burn more calories and effectively help people lose weight and or prevent weight gain, and also help prevent some of these chronic health issues like diabetes and metabolic syndrome. Physically active adults have a lower risk of depression and cognitive decline. Physical activity may also improve the quality of sleep. We also know that mental health benefits have been found in those who do aerobic or a combination of aerobic and muscle strengthening activities 3 to 5 days a week for 30 to 60 minutes at a time. Now, we are aware of the common health benefits of exercise, but let's listen to Dr. Kara Moore describe how exercise can positively affect our mental health.
Hey again, I'm Dr. Kara Moore from More Results in Louisville, Kentucky, and Reebok One expert contributor. Today I want to talk about the psychological benefits of exercise. Now, if exercise were in a pill form, it would be the most widely prescribed drug known to man. And the reason is because not only does it do so many good things for your heart, it also has a huge effect on your mental aspect and your mood. And so today we're going to talk about one of the big 3 things that exercise can really do to help improve your mood. So number 1, it helps to decrease stress hormones. So whenever you've had a hard day and you're stressed out, most people go for that low-hanging fruit, right? They're going to go and they're going to sit down on the couch, or they might go and grab a beer or a glass of wine to release that stress. But we know that exercise is one of the most effective things you can do. So going out for a walk or a run can help reduce those stress hormones. Number 2, it helps to release the feel-good chemicals in our brain, so we end up actually having a better mood. We feel better, we feel brighter, and so anytime that you're feeling down or you're having a bad day, one of the best things you can do is just to start moving. Start walking, go out, run some stairs, go out for a walk around the block. That can help to improve that mood almost instantly. Number 3, it just helps to improve confidence. So if you've ever had a really tough workout that you made it through, or you're able to accomplish something you haven't been able to do before, you notice that you have like increased swagger and you're feeling really good about yourself. So exercise can really make that happen. So if you have your clients who are really struggling with exercise, they're feeling down, they're not feeling quite like themselves, remind them of the big 3, the reasons why they should make exercise a priority. Number 1, it's going to reduce their stress levels. Number 2, it's going to help them feel better by releasing these feel-good chemicals. And number 3, they're just going to feel more confident and proud of what they've accomplished. I'm Dr. Kara Moore from More Results and a Reebok One expert contributor.
Be sure to read about the other benefits from physical activity in your textbook. The bottom line, the ending message here is that if you engage in regular physical activity, you will experience some kind of benefit.